showing you how one clinic is trying to prevent learning delays that can happen when students have difficulty with their sight. Our health reporter Haley Hernandez is joining me now with more on this.
Yeah, nothing would be more difficult than going back to school and not being able to read or see the overhead projector, whatever smart technology, whatever they use nowadays. I don't even know what's in classrooms anymore. But the Low Vision Clinic, the Dan Arnold Center for Vision Rehabilitation at UT Health Houston, Robert Cizik Eye Clinic, they basically help people who can't get any more sight out of glasses, contacts, or surgery. One boy from Kingwood was sent down the difficult path of even having to learn Braille. Dr. Iyer at the Low Vision Clinic said that's actually, it's really not necessary because there are a number of technological advances that can assist people with low vision. But this clinic really isn't just for kids. We showed you his story during the 6 a.m. hour, and now I'm going to tell you about how adults can benefit. Adults can get a lot of help from these devices in order to live independently and continue living their lives as they did when they were able to still see, or at any point if they were able to still see. But some may even be able to drive, and that's what I want to show you right now. With a combination of sight magnifying devices and the driving simulator that this clinic has inside of their clinic, therapists can determine if a patient should be driving or has the ability to still drive.
Usually 2 to 3 times is what most people that qualify for driving will be used. It's usually 2 to 3 times. We try not to go too much higher than that because then the field of view is too small. The area that you can see through that is too small. So he would just wear it and use his standard vision when he's looking through. His eyes would be sitting right there. And then when you need to see a road sign or a street sign, you just drop your chin and look through the telescope and then come right out. So you're not driving through the telescope the whole time because everything is 2 times magnified, right? So you use it just for spotting. So just briefly dip the head down and come right out. Less than a second, maybe second and a half. That's it. So the OT would be standing right next to them and administering the test. So the OT would usually talk to the patient and say, okay, what sign are you coming up to? What is the speed limit? But visual skills for the purpose of driving. So whether or not they're able to scan quickly.
Now for the bad news. These devices are expensive and they are not covered by insurance. But that's where Dr. Iyer's passion for helping her patients kicks in. She works with the manufacturers of these devices. She works with donors. UT Health has fundraisers in order to get these devices covered for patients who might not be able to afford it. And the other cool thing is that she has these devices in her office. So even if a patient can afford it but doesn't really want to make that investment until they know if it works, they can basically go try it before they buy it. But she says that they have never had to turn a patient away for not being able to afford these devices.
And remarkable to see these advances in technology and how they're helping so many.
I mean, they can be life-preserving, they can be life-changing. It's just, we depend so much on our sight for everything. Even somebody who would need to use public transportation, they still need to be able to see to use public transportation. So,
Most definitely.
yeah, really cool advances.
Thank you so much.
Thanks, Andy.